Okay. Okay, when we talk about biopsy of the prostate, during the biopsy itself, it doesn't cause the cancer to spread. That's definite because we use a small needle. And yeah, so biopsy itself is relatively safe. What we worry about will be things like infection and bleeding, not so much the spread of the cancer. The cancer shouldn't spread because you do a biopsy. The guided biopsy usually is not using a CT. We use an MRI. So like I mentioned in my talk just now, we do the MRI, then we fuse the MRI images to our ultrasound. So it's a real-time ultrasound whereby we can localize the area where we are worried about, and we can do a biopsy. Yes, it's slightly more expensive because of the new technology, but it has helped a lot of patients because we can then target these areas and pick up the cancers that would otherwise be missed if we can't target these areas. Okay, so for TURP and TUVP, the price is relatively quite similar. It all depends on the size of the prostate. The bigger the prostate is, the operative cost will be slightly higher. That's how it works in Singapore. So the only difference is TUVP, because the laser is slightly more expensive, so the price may be slightly higher. Okay, which one is more effective? Both are as good. So the important thing will be whether are you concerned whether there's any prostate cancer hiding inside? Because like TUVP, there's no histology. That means there's no biopsy, so to speak. Whereas TURP, we have the prostate tissue that we can send off. Okay. In terms of recovery period, TUVP may be slightly faster. Some patients can go on the same day. Most TURP patients will stay at least one night. So for patients, like I mentioned, TUVP can be used for patients on blood thinners. The reason being, when we are vaporizing the prostate, the laser can stop the bleeding much better than the usual TURP that we use, which is why those patients on blood thinners, if they want to choose TURP, they have to stop the blood thinners. Whereas TUVP, we can still continue with blood thinners. Okay, so we are talking about surgery for BPH, the benign enlargement of prostate. So if we do TURP or TUVP, the patient definitely will not be able to ejaculate. So it's a permanent retrograde ejaculation. So we can't avoid it because we need to cut all the way into the bladder neck, which is why those patients will find that sexual function is still very important. We will talk about the minimally invasive treatment, like I mentioned, things like Resume, ProLift, and UroLift. Of these three, UroLift still has the best advantage if you want to retain your sexual function, because the other two, there's still a small risk of causing it.